Welcome to The Explainer. You ever wonder about the tough moral choices behind the public health rules that affect all of us? Today we're going to dive into this constant, really high-stakes trade-off between our own individual freedom and, well, the good of everyone else.
All right, let's just jump right in with a real-life dilemma that puts this conflict to the test. It shows just how fast one person's choice can become a global problem.
So this brings us to a case where one single decision lit the fuse on an international health crisis, and it forced officials to make an incredibly tough call.
Okay, so picture this. It's 2007. A man gets diagnosed with a really nasty, drug-resistant form of tuberculosis, TB. His doctors gave him some pretty clear advice. Stay put. Do not travel.
But he didn't listen. For his wedding, he gets on a plane, flies from the US to Europe, and then back again. I mean, think about that. He potentially exposed hundreds of people on those flights to a dangerous, contagious disease.
So, when he landed back in the States, authorities basically had their hands tied. They had to act. He became the first American put under a federal quarantine since 1963. Now, on the one hand, that's a direct clampdown on his freedom. But on the other, what else could they do to protect everyone else? This whole incident is a perfect example of the ethical tightrope public health officials have to walk.
So that begs the question, right? How do officials even begin to make these calls? Well, they often lean on two core ethical frameworks. And, these two ideas have been clashing for centuries.
It really boils down to this. On one side, you've got the idea of doing the greatest good for the most people. But on the other side, you have this principle that certain individual rights are just sacred. They shouldn't be violated, no matter what.
Let's start with the first one, utilitarianism. This is the logic behind stuff like mandatory vaccines, or speed limits, or quarantines. Yeah, they might limit what you or I can do, but the argument is that they create this massive benefit for society as a whole, the needs of the many, right?
And then you have deontology. This idea argues that some actions are just plain wrong, period, no matter the consequences. It says you can't just use people as a means to an end. This is the philosophy that gives us bedrock principles like a patient's right to informed consent. Some lines just can't be crossed, even if it's for a good cause.
Okay, so here's where it gets really interesting. This philosophical clash isn't just for textbooks. It's playing out right now in public health debates you definitely recognize, maybe even in your own town.
Let's start with something that might be in your drinking water as we speak: fluoride. For decades, cities all over have been debating whether or not to add it to the public water supply.
And if you look at this table, you can see the two sides clashing perfectly. The utilitarian view is pretty strong. We've got decades of proof that adding fluoride to water is a safe, cheap way to stop tooth decay, especially for kids from low-income families. Huge community benefit. But then, you look at the deontological side. Is it right to basically medicate an entire population without asking each person? Opponents say no. That's a violation of their right to choose what goes into their body.
This same conflict pops up literally moments after a child is born. Should newborn screening tests be mandatory? It's a huge question.
The case for making it mandatory is a slam dunk when you're testing for something that's treatable, right? Like PKU. It literally saves lives. But the ethical ground gets a lot shakier when you move to the other side of this. What happens when these tests can reveal if a baby is a carrier for a genetic condition that affects their future choices? Or what about when those little blood samples are stored and used for research, often without anyone giving explicit consent down the line? That research could lead to amazing discoveries, but it definitely raises some serious privacy flags.
And as science keeps marching forward, these questions just get tougher. Public health officials are often forced to make huge decisions with, frankly, incomplete information. And that brings us to something called the precautionary principle.
It's basically the official version of better safe than sorry. The idea is, if there's even a suspected risk of harm, the burden of proof is on the people taking the action to show that it's not harmful. But, applying this is a really tricky balance. Let's look at a case where, looking back, we can see they might have gotten it wrong. This is a fantastic example of the challenge. Take the artificial sweetener saccharin. Back in the 70s, some animal studies linked it to cancer in rats. So precaution kicked in, and boom, mandatory warning labels on everything containing it. But then, over the next couple of decades, human studies found no consistent evidence of risk. It turned out the risk was specific to rats, not people. By 2000, the warnings were gone. The precaution was taken, but was it the right call in the long run?
All right, so this brings us to a final, really complex case that ties all of these ethical threads together. And it shows us that in a real crisis, there are rarely, if ever, any easy answers.
Let's go back to 2003. A new, deadly, and totally misunderstood virus called SARS starts spreading across the globe. The city of Toronto becomes a major epicenter. And in the middle of all that fear and uncertainty, every single decision became an ethical minefield.
And this is the crucial point. Every action they took created a brand new dilemma. They forced thousands of people into quarantine, trading personal liberty for public safety. They even publicly named a carrier to help trace the disease's path, but that shattered that person's privacy and led to the stigmatization of an entire community. At the same time, you have health workers with a duty to care, but that meant they were risking their own lives with no known treatment. And in the background of all this, thousands of other patients had their critical surgeries and treatments just canceled. That was the hidden collateral damage of focusing on this one terrifying threat.
Ultimately, the whole SARS outbreak taught us a powerful and painful lesson about global responsibility. In our super-connected world, when you're facing a pandemic, transparency isn't just some nice ethical ideal. It is absolutely essential for survival.
So the key takeaway here is that there's no perfect formula. There's no simple rule book to follow. Public health ethics is this continuous, incredibly difficult balancing act between our rights as individuals and our really profound responsibilities to each other.
And that leaves us with one final thought. We've seen how complex this is. We've seen the stakes. So when the next pandemic arrives, and it will, how do you think we should balance those scales? Where do you think the line should be drawn?